All right, we're going to go through a little anatomy lesson because I think that the more you know, the more you can help with visuals and taking these visual cues that a lot of us PTs will tend to use to help you get muscles to function better and be optimal. So this is a pelvis. This is a female pelvis. And you see we have the bones here, and the pelvis is, you'll hear a lot of us talk about it like a bowl, like a big salad bowl or a mixing bowl, because it has this shape or kind of bottom area and then sides around. So you have your pelvic bones, and then at the connecting portion in the back of the lower part of the spine, you have your sacrum, and it goes into your tailbone. Everything in red here are muscles. So this is the inside view if you were looking kind of like from the inside down into your pelvis. And this is the outside view if you were looking from the bottom up. Okay, so everything in red here are muscles for the most part, let's say. There's obviously skin and other tissues, but just to keep it simple. So we say pelvic floor, it's kind of like when we say core. But when we say quad or we say biceps, that's a very specific muscle we're talking about. You know exactly, there's no confusion. I'm like your quad. There's 4 muscles that make it up, it's a quad, or my biceps. But pelvic floor and core, those are like group terms because it's how they function together. But they're actually all distinct muscles. So these are all different pelvic floor muscles. So this is a different muscle, 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 this is a different muscle. This is a different muscle. Like there's so many, and I'm happy to share the names with them, but not necessary. But the way that they function together is they have to be able to fully contract together and fully relax. And in order to have healthy muscles anywhere in the body, the muscle should know how to fully create tension and shorten when needed, and fully relax and lengthen when needed. So if we start to have muscles doing things during times where it's really not ideal, like maybe a muscle is lengthening instead of contracting when it's supposed to be lengthening, that's going to cause dysfunction. Okay. Sometimes muscles will be overtrained and they're really good at contracting. I'm using this because that's what we PTs end up doing with pelvic floor muscles, but they're really good at contracting and shortening and tightening, but then they only kind of half relax. So we again want all of our muscles in our body to be able to go through a full contraction and a full relaxation. So back to the pelvic floor here. In this pelvic bowl, we have organs. This is female. So this is going to be our vaginal canal into the uterus, right? So that's what, when it goes through and creates the opening, that's our vagina, okay? And we have the bladder that's in front of that in terms of where it lives. So that is going to sit right behind the pubic bone as such, right there, bladder, and right behind the pubic bone, and that has the opening at the urethra where we urinate from. Then you have the rectum, right, where you empty your bowels from, and that sits behind, and it's going to empty right through our rectum here. So all of these pelvic floor muscles, their job is to support all of that, what we call viscera or organs. Okay, so it's very deep support that's trying to not only support those organs, but help us once again manage pressure during activities like jumping, coughing, laughing, sneezing. Okay, activities that would require these muscles to be able to fully lengthen and open and relax would be defecating, fully emptying our bladder when it's time to urinate, having intercourse, birthing a child. Okay, so you could see that there's all these different activities, and our muscles need to learn how to fully contract, fully relax during different activities or times.